employer brand has been something nobody really wanted to talk about 10 years ago. It was like, where do I advertise my jobs? I've watched this transformation that people have paid a lot more attention to employer brand. Over the past few years, it's been increasing. And in fact, every conversation I've been into, the employer brand has come into it. But employer brand, I think there's been a huge shift into like critical messaging that needs to exist right now around employer brand. In messaging that's unfortunately, we're freezing hiring on these types of roles, messaging towards critical needs, messaging internally to retain employees, understanding how the company's addressing those things. So messaging is something we got a lot of questions from people that were registered for the event. So have you had to make any changes to your brand messaging as a result of COVID-19?
This is Claudia. Our recruitment message and messaging is different, obviously, when we are in need of X, Y, and Z. So we have had to look at that and create different types of banners and advertising nationally. Specifically, we're delivering messages to our employees on a daily basis from senior leadership. We're giving a lot of, we're looking at the benefits that we are giving our employees, taking a look at what else we can offer our employees as far as what is the daycare look like. We brought that up before. So I feel we are constantly messaging and bringing out information to our employees. But yes, and our advertising has increased a lot. Our advertising on social has increased a lot. I see more people on LinkedIn, and our recruiters here in nursing are tasked with making sure that they reach out to those individuals on their LinkedIn pages and making connections, because that's a way of us getting out there and hopefully bringing some folks to us. But most importantly is really keeping our employees connected and understanding, where we are, what we're doing. There's a data, a portal, if you will, every day that comes out. So it's over messaging, but it's important for us to do at this time.
Oh, that's great.
I'll add a little bit of a different example. So my team, we're marketers at the heart of what we do. So typically, we come up with content that's based around employee stories, those messages, our employment value proposition. But we knew that this time it had to be different. I guess in a way it's like, how could you not adapt, right, to having, some new brand messaging? March, for instance, is Women's History Month, or Women's Month, however you'd want to call it. And we had a full content plan, an editorial calendar that was full of really great content. But I'll be honest and say we made the decision and had to remain flexible and pivot to really talk about what employees need now, what candidates need now. And in a matter of days, we were able to do it. I honestly believe that in times of uncertainty, like right now, the best thing that we can do is to address these topics as quickly as possible. I will say that the best thing that we did was to partner with our marketing team, because I have a saying: customers are candidates and candidates are customers. No one's like, oh, that's that's a company that I want to work for, but that's not a company I want to buy from. Like that doesn't really work well. There's definitely that convergence of the employer brand and the consumer brand. So it was not an option for us. We needed to partner with marketing, and we're all the better for it. We were actually able to put out a lot more content that was really relevant to both audiences at the same time.
Yeah. CVS Health launched a COVID resource center that I think has been, I mean, everyone on the webinar right now can go to it. They update that frequently with information, and that's external, internal. I thought that was a really helpful thing that the CVS as a company has done to keep people informed. And we also, like so many of you, have internal colleague communications, but I thought producing a sort of resource center for all of our communities was a nice thing to do and help keep everybody that we serve informed.
I wanted to add sort of my perspective in sort of seeing how a lot of employers are acting in this crisis. Every crisis is an opportunity, and I think that we are coming to a point where after COVID-19, there may be an employer branding crisis. Physicians and healthcare professionals are very, very upset right now about the lack of PPE, and it largely is not the fault of employers, but the way that employers are responding to the concerns of their physicians and healthcare professionals, the people who are fighting on the front lines, has been a little bit concerning to me. And just a cursory look on Twitter, looking up hashtag nurse Twitter or hashtag med Twitter, you'll see so many stories of draconian policies being placed onto candidates. And if employers do not act transparently, with integrity, and with commitment to the mission, they're going to see flight from their workforce. But the organizations that really do act in the right way, I think, will be the benefactors and will become employers of choice. It's tough to think this way when you've got a crisis in front of your nose, but I do have some concern for employers out there, what this is going to mean for their talent acquisition efforts in the future.
Yeah, I mean, wonderful on this. Like, what I definitely heard through a lot of this panel is that communication is not just sending out an email. I'm hearing engagement in social and content and building out an entire portal to address that. I think, to Greg's point, that how people are being treated and recognize their own brand or see brands responding currently will affect the future ability to recruit. I think that's an excellent point on that. 60% we're seeing almost are adding COVID-19 messaging to their employer brand channels, updating career sites. So we're seeing that companies are recognizing that, but that was only 68%. That means not everyone's doing it. And then healthcare companies are adding messaging specifically to job titles and descriptions. We ran a case study against this and saw that there was a 108% increase on the average apps per job by including COVID-19 in the title. And the average conversion rate of those jobs was 206%. So even just making updates to the job descriptions is making an impact in the ability to acquire talent.